Hello everyone, and welcome to this audio podcast. Wherein the plan is to provide an overview around Huntington's disease. This is the Shientist, and this is another Storm Robotics production, and in part with the Blittztorm intermission. So a bit of sort of uh, uh, introduction, a bit of introduction or background to begin with. So Huntington's disease is a disease that can be placed within neurology and genetic disciplines, and it is a disease that is a progressive brain disorder that causes uncontrolled movements, mental problems, and loss of thinking ability in context of cognition. And adult-onset Huntington's disease is perhaps one of the most common forms of Huntington's. Usually begins in middle age. Signs and symptoms can include irritability, anxiety or depression, small involuntary movements, poor coordination, and trouble learning new information or making decisions. As the disease progresses, involuntary jerking movements, something that is referred to as chorea, can become more can become evident and more pronounced. Affected individuals may have trouble walking, speaking, and also the people with cases or people with the Huntington's also typically experience changes in personality and decline in thinking and reasoning abilities. Individuals with forms of Huntington's disease generally survive around 15 to 25 years post onset. There is also an early onset form of Huntington's that begins in childhood or adolescence. HD Huntington's disease is pain pathogenic is a pathogenic autosomal dominant progressive neurodegenerative disorder that is caused by mutations in the HD gene. The prevalence of HD genes from 3 to 7 per 100,000 among Western Europeans to 0.1 to 0.38 per 100,000 amongst those for example, the in amongst Japanese, at least where epidemiological investigations have identified. And the variation in prevalence reflects the variation in distribution of Huntington's alleles and haplotypes that are predisposed to mutation. In context of the HD gene or Huntington's gene, the Huntington's gene makes a protein called Huntington. The exact function of this protein, at least in literature, historically or retrospectively, has not been known, but it does appear to play an important role in nerve cells. And so within cells, Huntington's may be involved in signaling, transporting materials, binding proteins, and other structures, and protecting against programmed cell death, for example, apoptosis. The Huntington protein is required for normal development before birth, and it is expressed in many tissues in the body, with the highest levels of expression seen in the brain. One region of Huntington's gene has particular sequence of three DNA bases, the CAG that is repeated multiple times and bases are generally are known to be the building blocks of DNA. I'm going to highlight a little bit around a case study in this slide set as part of this slide set. So MP, a 45-year-old old man or male, presented initially with a decline in memory and concentration at his intellectual function as his intellectual function deteriorated during the ensuing year. He developed involuntary movements of his fingers and toes, as well as a face face grimacing and pouting. He was unaware of his condition and became depressed or had anxiety, and he had been previously healthy and did not have a history of any similarly affected relatives. His parents had passed away in their 40s in an automobile accident. MP had one healthy daughter. After extending evaluation, the neurologist diagnosed MP's condition as Huntington's. The diagnosis of Huntington's was confirmed by DNA analysis showing 43 CAG repeats in one of his HD alleles. The normal sort of range is less than 26. Subsequent pre-symptomatic testing of MP's daughter showed that she also inherited the mutant HD allele, and so both received extensive counseling. So, investigations around Huntington's include a combination of movement and surrounding movement disorders and mental, emotional, and behavioral changes, and can be caused by several different conditions. Huntington's is considered first in a person with a known family history. A person of having any such combination of symptoms will probably will more than likely be referred to a neurologist, and the neurologist will ask several questions about the symptoms and how they started and other medical issues. For example, in the current and in the past, alongside family medical history and medications, work and travel history, and habits alongside lifestyle. A detailed physical examination will include tests of movement and sensation, coordination, balance, reflexes, other nervous system functions, and mental status. The main goals of sort of the examination or investigation side is to sort of identify through examination whether to identify through examination the exact disabilities, and to rule out other conditions that can cause similar symptoms. In context of laboratory investigation, the tests are used to confirm the diagnosis of Huntington's alongside dementia. So DNA repeat expansion, for example, the test identifies Huntington's mutation. It uses a technique retrospectively known as polymerase chain reaction, or PCR, to measure the number of CAG repeats in the HDI IT 15 gene. This test is very tends to be very tends to be accurate in confirming the disease because no other similar disease has the same specific gene mutation. Vanillic acid or vanillic acid is a product of the neurotransmitter dopamine, which plays an important role in the movement that is linked specifically around Huntington's. The amount of hormonal acid in the cerebral spinal fluid is lower in people with Huntington's than in healthy people, and the degree and reduction in hormonal acid level is a marker of severity of dementia and life expectancy in Huntington's. A sample of the fluid is obtained for this investigation by lumbar puncture. In context of imaging, brain scans can be useful in measuring the extent of potential brain damage in Huntington's. So CT scan or MRI of the brain shows atrophy, or where there can be shrinkage of the parts of the brain affected by Huntington's. Single photon emission computed tomography or SPECT can show changes in metabolism and blood flow in parts of the brain affected by Huntington's. Position emission tomography or PET scan can show changes in brain function that often occur before symptoms begin in Huntington's. The scan is available only in a few large medical centers, at least historically, and it generally its usefulness in surrounding Huntington's has been sort of documented or evidence in some more recent literature. Differential diagnosis. So Huntington's must also be differentiated from other disorders or conditions associated with chorea, such as, for example, Wilson's disease, drug-induced tardive dyskinesia, Sydenham's chorea, systemic lupus erythematosus or SLE, senile chorea, a symptom complex primarily characterized by the development of chorea after the age of 60. And although some patients with senile chorea may have neurodegenerative changes of the caudate nuclei, there is typically no family history of Huntington's. Finally, in context of Huntington's around education and management, and it is important for Huntington's patients or cases to be physically fit as their condition permits, and daily physical activity promotes physical and mental well-being, and patients should should walk as much as possible, even if assistance is necessary. And while it may be emotionally difficult, it is important for cases and caregivers to make informed, carefully considered decisions regarding future whilst the patient is capable of making his or her own contribution to a planned course of action. And cases and should discuss and consider issues such as legal concerns, home care, assisted care, and institutionalization, if and where that may be warranted, if that might be warranted. And there's generally no known cure or specific cure for Huntington's, Huntington's usually runs its full terminal in 10 to 30 years. It has been observed that the earlier in life the symptoms of Huntington's appear, the faster the disease sort of progresses. The sort of bedridden patient in some cases of Huntington's is generally the final stages of Huntington's, often where they can often unfortunately die from complications such as heart failure or pneumonia. And juvenile Huntington's disease runs comparatively faster, with death typically occurring in about 10 years. So once again, I want to say thank you for tuning in on this audio podcast surrounding Huntington's disease. This slide provides an overview of some dedications that have been listed out, and where the works had been inspired. And once again, this was a Storm Robotics. This has been a Storm Robotics production, and this has been this is the Shientist, and this has been an overview surrounding Huntington's disease as part of the Blittztorm intermission. Thank you for taking the time to tune in, and hopefully there'll be another series surrounding another aspect of clinical or laboratory medicine or pathology to follow. Thank you.